Now, South African authorities have seized hundreds of fake COVID-19 vaccines following a global alert issued by Interpol. For a reaction to this, I'm joined by Mokgadi Fafudi, who is the Manager for Regulatory Compliance at the SA Health Products Regulatory Authority. So good to be talking to you this afternoon. Give us a bit more details about these fake vaccines, where they were from and what they were made out of.
Hi, Tammy. Thank you for awarding me with this opportunity. So, in relation to COVID-19, SAHPRA is conducting quite a number of inspections together with the South African Police Services. So, in this instance, the raid was done in Germiston, and this was in November last year, and 400 pre-filled syringes of vaccines, which were fake, were found in that facility. And this were, the people who were involved were 3 Chinese nationals and a Zambian national. And then these were confiscated, and then the case is currently ongoing. There's a criminal case to this effect that is currently ongoing. This, at the moment, is the only case that relates to the fake vaccines. And because of our regulatory framework, we haven't had any other problems in relation to fake vaccines. And yes, it's not only vaccines, there are other products that are related to COVID-19, which are fake or not authorized, that we are currently also working on.
And how widespread is this problem? How prevalent are fake medicines in the market?
You know, Tammy, the good thing is that our port of entries have got good control. So together with Customs, SAHPRA, which is ourselves, the police, and Port Health, we have a forum where we are regularly communicating, and then we have a framework of any medicines that are coming into the country that are not meeting the requirements will not be released, and they will be dealt with in accordance with the law. So in that regard, the problem is not very much. And we are seizing a lot of those, and criminal cases are currently ongoing. And we've got our inspectors who are on the ground on a daily basis. We are doing detection. We are trying to prevent this from happening. We are collaborating with also our social networks, such as Facebook, for example, in terms of detection and also removing those. So our inspectors, together with the police, are conducting raids. As soon as we hear about this, or as soon as we have suspicious activities, we do go and conduct the inspections to make sure that we manage this.
And I wonder if you've dealt with this type of situation before, where you were able to analyze and find out what the physiological impact would be for those who actually do consume fake medicines on the market.
Oh, yes, Tammy. Hence the existence of SAHPRA, to make sure that these facilities are licensed and that these products are authorized or are registered. So in this instance, if we're speaking about the vaccines, because these are biological products, so the problem that can result is that you find that there is actually no active pharmaceutical ingredients, or they are contaminated, this product, or they've got wrong chemicals or biological products. And you can imagine, if people consume this can result in more infectious impact, and then people not being able to be treated with the existing medicines or treatment that is available. And also the risk is that people can lose confidence into the healthcare system, because these are coming into in a wrong name. And the confidence of people will be lost. And also, we know that this can actually progress the disease. And in some instances, there are deaths that have been reported. So, and fortunately, because this is during a pandemic, this is not only South Africa that is affected. Other nations are also having a similar problem. We are also working with Interpol in terms of the alerts and collaborations to make sure that we prevent and manage this problem.
Now, this is happening on the backdrop of South Africa beginning its vaccination process, obviously with healthcare workers first, and then it will be the next phase with the general populace. How likely are people to be getting fake vaccines?
I would say very unlikely because we've got a regulatory framework and also the communication. I'm sure you have seen how communication has been forthcoming from the department, from SAHPRA as well, through our CEOs and other colleagues of mine. So there are measures in place to ensure that people only follow the correct channels, the authorized channels of accessing health products. For example, in South Africa, the framework is that through the Medicines Act and through the South African the Pharmacy Act, the people can get health products through facilities such as a pharmacy, hospitals, clinics that are registered and authorized in order to make sure that the products are valid and authentic. So in this instance, for example, we start first with controlling the port of entries. As I mentioned, that SAHPRA, Customs, Port Health, and the police, we are managing them. And those that are already in the market, they will be sought through the correct facilities that the Department of Health is informing people to get them through. So it is very, very important that people are alert and they access this through authorized channel. Anything else, we actually ask them to contact us to let us know, and then we will investigate those facilities if they are authorized to issue such product, and we will also authenticate if those products are authorized or approved.
Is there a way for consumers, just by looking at a product, is there a way of them identifying whether a product is authentic or not?
So the source of the product is the most important one, Tammy. So where the person sources the product is very, very important. Vaccines can only be sourced, for example, through a hospital that is registered. It can be private or public. They can be sold through a pharmacy that is registered with Pharmacy Council. The product itself, it must be registered with SAHPRA or approved in terms of Section 21. So there is a certain labeling that is authorized, packaging that is authorized. So it's quite complex for me with this short period of time to explain that process. But I advise the public to only seek healthcare products from healthcare facilities such as a pharmacy and a hospital and a clinic that are licensed and registered through SAHPRA or the Department of Health or Pharmacy Council. In that way, they will be able to authenticate if the product is a valid one.
Ms. Fafudi, thank you very much. No, please go ahead. I see you want to say something further. Please go ahead, ma'am.
Okay, I wanted to also say that on our website, we regularly provide with information and updates on what the people can look out for and what information they can access. We also have got social media platforms like a Facebook where people can ask questions, and we will be able to answer such questions. And our website also has got our contact details. My unit is the Regulatory Compliance Unit. We've got contact details where people can get more information if they want to verify the products that are available or to report non-compliance matters.
And certainly having the correct information is key, because this really is